Like millions of other parents, if your child is struggling with a substance use disorder, you may find yourself asking, why won't my child just stop using? I'm here to tell you why. In this video, I'll walk you through the typical progression of substance use disorder. Then I'll explain why your child can't just quit as much as you want them to and as much as they may even want to. First, it's important to recognize that a substance use disorder is a diagnosable illness that can significantly impair your loved one's mental and physical health. Next, understanding how substance use disorders develop can help you make choices that will support your child's recovery. This will also further your understanding about why substance use disorder is a disease, no different from other diseases like diabetes or cancer. Like those illnesses, substance use disorder is not a choice. It's not your child's fault, and it's not your fault either. A substance is a chemical compound that affects brain activity and function. Some substances are legally prescribed by medical professionals for use as a part of a controlled treatment plan. Many substances are acquired illegally. For this course, we want to focus on substances that negatively affect a person's health and well-being. These are substances that can lead to a substance use disorder. Examples of those substances include, but are not limited to, nicotine, alcohol, cannabinoids or cannabis like marijuana, opioids, depressants such as benzodiazepines, stimulants like cocaine and amphetamines, and hallucinogens like LSD, psilocybin, and other compounds such as ketamine or ecstasy. Misuse of those or other substances can profoundly alter your child's brain chemistry, so much so that the substance eventually appears to your child to be necessary for survival. This is what leads to substance use disorder. It's also what makes stopping substance use extraordinarily difficult, especially without help. I want to take a minute to talk further about brain chemistry. The brain is still actively maturing until approximately age 25. The process of sorting behaviors that support long-term well-being is a normal component of brain development. This is why adolescents and young adults are at increased risk of developing particularly severe substance use disorders. So when you combine substance misuse and the developing brain, it creates a perfect storm for a bad outcome. Fortunately, neurobiological research or studies in brain function has given us new tools to prevent substance use disorder before it starts, identify emerging cases of substance use disorders, and effectively treat fully developed substance use disorders. Here's an example. As I mentioned before, we know that substance misuse can take over the brain. More specifically, it can take over 3 separate areas: the basal ganglia, the extended amygdala, and the prefrontal cortex. This disruption leads to irresponsible decision-making, such as continuing to use substances despite negative consequences, which can affect health and behavior, such as driving under the influence. In addition to brain chemistry, other factors can contribute to the development of a substance use disorder. These factors include psychological and social influences, mental illness, and genetic predisposition. You'll learn more about these in the next 2 videos. The good news is that addiction specialists now know so much more about the causes of this disease. Remember, recognizing that substance use disorder is an illness, not a choice, can help you forgive your child for their behavior and the negative feelings you may experience as you support their recovery. It can help you forgive yourself too.